Hi, I'm Jen Gordon, and I have EGPA, a form of ANCA-associated vasculitis.
Hi, I'm Mitch Horowitz, and I have MPA, and I'm also a registered pharmacist.
We're here today to talk about things to help when you're prescribed medications for vasculitis. So your doctor wants to prescribe a new medication. The first question is why? What is this medication supposed to do for me? Mitch, you're a pharmacist as well as someone living with vasculitis. Tell us your thoughts about this.
Yeah, definitely the first question is, what should I expect to happen when I take this medication? What's going to improve in my life? So there could be a lot of reasons that a doctor would choose a particular medication. Might want to treat an active disease symptom, might want to maintain a remission having already treated the active disease, might be treating a flare, which is an reactivation of the disease in between calm periods. And they also may be treating side effects, which is a very common thing to do because our medications tend to cause side effects.
Okay, great. Anything else you can tell us about that?
Yeah, I would say ask the physician and the pharmacist. You could ask them the same questions. First thing is you would likely get a printout of something from either the doctor or the pharmacy. And it should address issues like, when do I take this medication? In the morning, in the evening? These can affect how well the medication works. Also with meals, before or after meals. Before is usually considered 1 hour prior to eating, and after 2 hours after eating. And then you want to know about food interactions. Sometimes milk will interact with medications because it's dairy products in general are rich in calcium. Iron tablets or foods high in iron can also bind with drugs and prevent them from being absorbed. Alcohol, another thing to concern yourself with. Does alcohol get potentiated, made stronger, the effects of alcohol? Will you get very drowsy from it? Also, you want to know where to store the drug. Sometimes you have to keep medications in the refrigerator, sometimes at room temperature. Most people keep them in the bathroom medicine cabinet, which is probably a bad idea due to the humidity that showers and things can generate. I would recommend if you can keep them in the kitchen. You do have to find a place, if you have children, where you feel it's safe. So those are some things that your doctor and or your pharmacist should be able to tell you about.
That's a lot of great information. Thanks, Mitch.
Okay, and I would also say I would recommend using one pharmacy if you can. Most pharmacies will have software that's dedicated to finding drug interactions. If you fill your medications at the same pharmacy, they'll have the opportunity to scan for drug interactions. Whereas if you go to different pharmacies, one pharmacy will not know what the other pharmacy has dispensed.
Great. Thanks so much, Mitch.